Hi, my name is Tracy Morin. I work with Day One, which is a residential substance use facility for adolescents, and I work in the Hinckley program with adolescents boys. I am their program coordinator, so I supervise the clinical staff. I work with interns and work with the community educators. With my role, I supervise the clinical staff, as I said, but I also run groups. I run the group supervisions. I maintain a small caseload, and I work on the floor with the clients. So I've always wanted to work in this field. I've had a passion for it to help others. When I was around 8, I remember being outside on the playground wanting to be someone to help others. I didn't have that support when I was a kid, and I wanted to be that guide for someone else. And like I said, as long as I can remember, I've always wanted to do this. As soon as I got out of high school, I went into college and studied for my social work and counseling. I have my bachelor's in that. And then I started working in residential settings with adolescents, and that's been my passion ever since. And currently I'm studying for my clinical mental health counseling degree. So one thing I really enjoy about this field is seeing the clients grow. When a client comes in for their first assessment and they're withdrawing from their substances, and then from there, we admit them to the program and we start working with them and see. I'm fortunate enough to work with them for 6 months and seeing them grow from that moment until their graduation moment, and their willingness to change and work on all kinds of different aspects of their life, not only the drugs, but their family and emotional stuff, is really gratifying. And seeing that a kid just jump back in and become, see that light within them is really nice to see. But with that, one of my challenges is when the clients don't put in as much work in and I ended up doing more work than them. That makes it difficult, and it's the same when the staff's not doing as much work, and as a supervisor, I have to engage the staff, but sometimes that gets frustrating as well. So one experience I can remember clearly is one of my adolescents was having a really difficult time, and I was getting ready to leave, and she was in the bathroom, and I hear her calling my name. I go down, and she had attempted suicide. So I had to go in, and I have her in my arms holding a towel, stopping the blood, and was very calm and keeping her calm, and got the other staff involved to call the ambulance and things like that. And, she was able to recover from that, came back into the program, and struggled for a while. And she eventually left that program and struggled for a little bit, but then turned her life around and reached out and contacted me, and she had a baby, and it was amazing. She brought this child into my program, and it was just, you could see the life in this girl, and it was just, wow, we made an impact on her, and she was able to change her stuff around, and it was really nice to see. Unfortunately, this young lady stays with me because she was driving home from an AA meeting and died in a car accident. So it was just, but she was succeeding, and so it's just impactful still. It was really there for me. So my advice for people wanting to get into this field is make sure you follow your passion. Continue going forward and never stopping, and don't give up, because it's going to be very easy to give up on this population, and they need that support. But also looking at your own self-care, that's going to be very important, because burnout's very high. And if you're taking care of yourself, and you're able to take care of your clients, and that's very important.